Welcome to our series on Masshealth and Medicare, brought to you by the Northern Hilltown Consortium of Councils on Aging and funded by a service incentive grant from the Executive Office of Elder Affairs. My name is Deborah Hollingworth, and today this information that's being presented was gathered from years of helping individuals and their families understand Masshealth and Medicare programs and regulations and how to apply for both. Today, we're going to focus on Masshealth programs that pay family caregivers for the care they provide. And the first of these programs is the Pca Program. That's Personal Care Attendant Program. And this program was started back in the late 60s by a series, I'm trying to think, there were a half dozen or so young men who were quadriplegics and needed an amount of care that made them nursing home eligible. They didn't want to be in a nursing home, they wanted to be at home and more independent. And this Medicaid program was created back then to provide personal care assistance for individuals so that they could avoid the nursing home placement. So, if you qualify for Masshealth, and you need help bathing or dressing or help managing your medication, maybe you need help with meals, laundry, grocery shopping, these are the tasks that Masshealth will pay your caregiver to provide. The rules and benefits for a Pca program are that you must have Masshealth standard in order to enroll. You should be able to hire and fire your own worker, although if you're not able, you can have a surrogate, perhaps another family member, oversee the time slips and to make sure they're submitted. A Pca worker is going to be on the Masshealth payroll. They get a check every 2 weeks. At the end of the year, they get a 1099, and they're covered by workman's comp and unemployment insurance. A Pca program participant can be any age. So that's the youngest one that I'm familiar with was 14 months old, and this was a baby that was quite compromised and needed an incredible amount of care. And the parents applied on the baby's behalf and were able to hire workers to help them to avoid a nursing home placement. And that's basically the premise behind the Pca program. Let's keep people home. It costs the state of Massachusetts less, and it's a better environment. And for folks who are enrolled, it's a better solution. Once you have Masshealth standard, you can call a Pca program provider, and they will send a nurse out to do a medical assessment and develop a care plan. And that nurse is going to ask a series of questions, do a medical interview that will determine how much help you might need with bathing, or with getting to and from the bathroom, or dressing, or doing laundry. And they assign a certain number of hours per day, which become hours per week, and they submit that care plan to Masshealth. Once it's approved, then the Pca program allows you to hire your own caregiver. And that can be anyone you're not married to. So you can have a son or a daughter, a neighbor, a grandchild, a friend, and you hire them to become your personal care attendant worker. Masshealth is going to write the paycheck for that. The program will show you how to put together the pay slips, submit them to payroll, and for the Pca worker, they're covered by workman's comp, and they get unemployment in the event that you don't need them at some point, and they need to find other employment. This plan works pretty well for folks who are independent enough to hire and fire their own worker, to supervise an employee, so to speak. If you're trying to provide care for someone and they really don't have that capacity to supervise a worker, they can have a surrogate. So another family member who will supervise the time slips and make sure the work is done. I'm going to switch now and talk about another program that would pay family caregiver, and that's called the Adult Family Care Program. This also was invented back in the mid-70s, and back then it was called the Adult Foster Care Program. And it functioned much like foster care would for kids, only it was foster care for folks who were 65 or older. You needed to have Masshealth standard, and you needed to be significantly frail. What does that mean? It means that you have difficulty being home on your own. You needed 24-hour supervision, and for the same tasks, bathing and dressing, getting to medical appointments. You were fine if you could live in a supportive environment, but couldn't manage to do that on your own. The Adult Foster Care Program, I think, was first featured way back probably in the late 70s. Charles Kuralt, that's a CBS series, some of you may remember. Charles Kuralt on the road did an interview with a gentleman in his 70s in Kansas, I believe, and he'd been placed with a family. Otherwise, this fellow would have been in a nursing home. And this was an interview done at Christmas time, and it was one of those human interest stories, heartwarming. Here was this gentleman on a toboggan. The family was getting a Christmas tree, and he was able to say how much happier he was living with his new family rather than his other option, which was a nursing home placement. The Adult Family Care Program really began to take off and get a little bit more popular when they changed the name, and this happened early in the 2000s, and they no longer called it Adult Foster Care. They called it Adult Family Care. And there was a shift to make it a little bit more flexible in that families could actually be the family care provider. So if mom or dad needed significant help at home and they qualified for Masshealth, they could enroll in an adult family care provider program. And that program of the provider could be anyone you're not married to. So it could be a son or a daughter. Now this works well if mom moves in with the daughter, or vice versa, the daughter moves in with mom, and the objective here is to keep mom out of a nursing home. The thing about adult family care is that you can also participate in other Masshealth programs. So let's just say this was a daughter who had a full-time job. She had to give it up in order to take care of mom, but she moved in with mom, began to provide that 24-hour oversight supervision for mom, and mom went to an adult day health program Monday through Friday. Daughter went back to work. However, the daughter was there, lived with mom, and therefore provided help with meals and groceries and laundry and getting mom to and from the doctor, all the things that you would figure were necessary in terms of keeping mom out of the nursing home. Here are some of the rules and benefits for the Adult Family Care Program. First, either mom or dad, whoever is going to be the participant, needs to have Masshealth. Secondly, the home that they live in must meet code enforcement standards, so there is a home inspection. Thirdly, mom or dad can participate in other Masshealth programs. So they could go to an adult day health program. And this works sometimes really well for a son or a daughter who has a job. They have mom move in with them. They have to either reduce their work or quit their work. And mom's able to go, because mom's able to go to an adult day program, the daughter can go back to work. To participate in adult family care, you need to be 18 or older. So how would you decide which program might be best for you if you were a family caregiver? Let's think of a couple of examples here. Let's say mom had a fall recently. She fractured a shoulder. Now she's at home. She's having a hard time using her walker. This begins to sound like the PCA program because mom is still alert and capable. She's just physically impaired. So the PCA program, a nurse would come in and determine how many hours of care mom needs. And then the daughter, if the daughter is providing that care, would get paid those number of hours by Masshealth. If it's a different situation and we've got mom who is not clear in her thinking, maybe she's had a fall and had a recent hospitalization, some surgeries, been in a skilled nursing facility for rehab, and now she's back home, and the family feels she's really not safe to live on her own any longer, and a family member moves in with her. That's kind of the definition for the adult family care program. And the difference in the rate of pay is an adult family care program pays a stipend. Means that the care provider is paid by Masshealth $18,000 a year, and that's tax-free. Let's contrast that with a PCA program where the family member is paid an hourly rate, and the number of hours they get paid is determined by the nursing assessment. Does the care plan, submits it to Boston, Boston approves it, and now you're paid for a certain number of hours. And typically a PCA program worker might get paid 15 hours a week, 25 hours a week. The most extensive care plan I have seen in the past years was 77 hours a week, and this was for someone who was quite incapacitated. Those high number of hours are unusual, and I would say PCA program care plans usually run somewhere between 15 and 35 hours a week. So depending on your situation, one of these programs might work very well for you. And it is kind of a way for families to get compensated for the care they provide, and a way for the state of Massachusetts to avoid another nursing home placement. So it's a win-win. For more information about these programs, you can call Highland Valley Elder Services and ask for an options counselor. That's also true for West Mass Elder Care, Greater Springfield Senior Services, Life Path up in Greenfield. They all have either a caregiver program or an options program counselor, and both of them can think about your situation and figure out which of these programs might work best. For more information on how to qualify for Masshealth, you might contact your local senior center and ask for a SHINE counselor to see if perhaps we might be able to get mom or dad qualified for Masshealth. Thanks again for joining us today. I hope this was helpful, and for more information, you can always contact the following resources. Thank you.